So, how do you respond post-cancer treatments when your chemo is done, if you had to do radiation surgery, etc.? How do you respond when people ask you, so, are you good now? Is the cancer gone? How do you respond? I am curious because the first time around when I had cancer, my response was, yes, I am good. The cancer is gone. But since I got the cancer the second time, when people ask me the question, what I tell them is, I don't know if I am. I don't know if I'm good. I hope I'm good. And I really mean that. So please tell me, how do you respond when people ask if you're doing okay now, if the cancer is gone? Hello, everyone. This is Kim. I hope that you all are doing well. If you don't know me, I am a now 15-year breast cancer survivor. And I say that because I had cancer over 15 years ago. I was first diagnosed with breast cancer, ended up getting a recurrence in 2023. So although I just called myself a breast cancer survivor, since I got the recurrence, I now call myself a breast cancer fighter. If you are new here, welcome to my channel. All of my current subscribers, hello you all and welcome back. So in this video, I just wanted to give you all a health update with the cancer and everything surrounding that. The last time I made a video about cancer stuff was it wasn't September. Last year, September 2024, I had a surgery, more reconstruction surgery. Then I made a video, I want to say in October of last year, just to talk about that reconstruction surgery, but I have not been on here to talk about health, cancer, anything. That's what this video is about. So I've always considered myself to be a pretty healthy person, but can I still call myself healthy after cancer? Or since I've had cancer, am I still considered healthy because I didn't do anything to cause the cancer? Again, I've always eaten properly to the best of my ability. I exercise, but obviously there is something within my DNA, genetics, a mutated gene, or something that caused the cancer. So again, am I healthy? Do you still consider yourself healthy because you got cancer? Let's talk about that a little bit. Last year, 2024, I had a pretty crazy year. So 2023 is when I got the diagnosis of the recurrence. So that was a crazy year with the chemotherapy and all of that. But then fast forward to 2024, it was another crazy year, you all. From having a ruptured implant on the right side, having, built up fluid, which was blood that they never found out what that was about. What else? I had to get some CT scans on my head because I had a lot of headaches, just a bunch of stuff. I had some back pain, so I had to get a CT of my spine, chest issues where my chest would hurt. And the last exam I want to say I had last year was a scan on I had a scan on my heart, but then I have now, I don't know if you can see them, I have some type of, like a couple little knots here. And when I told my oncologist about this and showed him, he pretty much said, oh, we'll ask your breast surgeon about it. But he started to make me think that I was crazy because I come to the doctor for everything now because of the second diagnosis. And he said, well, maybe it's all in your head. Now I'm starting to feel that people are starting to downplay things that I'm going to the doctor about, and it's making me just question myself a little bit. I have every right to question things when it comes to my health. I went to the plastic surgeon to talk about the knots that I have here, and he said, I think it's just from surgery. It just appears to be, some type of, my ribs are kind of showing now because of all of the surgery. But you all, I am still struggling with different things. Again, I don't know if it's all in my head. I don't think so, but we know when our body just feels differently. So that was 2024. Fast forward to 2025. Another reason I'm making this video is just because last week was pretty weird for me. So I met with a new oncologist because my oncologist went somewhere else. So it's the first time I was meeting with a new oncologist. He's awesome, older guy, just very particular, which I love. When I go to my oncology appointment, the first thing I have to do is get labs drawn, so get blood drawn. I go back in the waiting room to sit there just to wait until the lab results are back. My oncologist has time to review them, and then he calls me back. So on, was it Wednesday or Thursday? Thursday of last week, when I saw him, it was time for him to review my labs. And one thing he said as he started to go over my history and he looked at my labs, keep in mind, I've never had issues with labs. When I was going through chemotherapy, some things were off, but everything kind of caught back up. So when he looked, he said, I wonder why your potassium is so low. So my potassium came back really low, not severely, but it was really low. And my glucose came back low. So that was bothersome because I never have issues with my labs. So immediately he said, for this potassium, well, first thing he asked me was I on diuretics, which I am not. He said was, you know what, I need to prescribe you a potassium pill that I want you to take. But also after you leave here, I want you to follow up with your primary doctor so that she can get you in and so that we can keep tab on your levels because they are low. So right then and there, I did follow up with them. I have an appointment to see her next week. But let me tell you why I'm just a little bothered. I think I was just kind of thrown off with that because once I got home, you know what I did? What do we do when we get results that we want to know more about? I went home and I started to Google. And that's when I started to get scared. I started to look at, what it means when your potassium is low. Is there an underlying issue? It could be this or that. And it started to make me a little nervous. I started to just speak out to God. I said, you know what? I know they said my potassium is low, my glucose is low, but it's not. It is not. And I just asked him to heal my body. So I just wanted to make this video to give you all a health update, to know where I am. And I really don't know where I am right now. I just pray to God that I'm going to be okay. And I pray that I don't have any underlying health issues. I pray that the cancer is all gone. And another thing that bothers me about once we get through treatments for cancer, one thing that bothers me is the fact that once we're done with chemo, radiation, and all of that, they never follow up with us. And I don't know, tell me if this is the same for you. They never follow up with another scan. I don't know why they don't do that. I don't know why they just assume that the chemotherapy and all of the treatment just took care of the cancer, but that's something I'll follow up with my oncologist in about 8 weeks. Again, I'm rambling in this video, but I just wanted to let you all know my health update. I think I'm okay. I don't know if I am okay. But since Thursday, when I got the results of the potassium being low and the blood being low, my body just feels weird. And I don't know, again, if this is all in my head or is there something really going on? The low potassium and the low glucose probably does explain the reason I get so fatigued, after work or even during work. Sometimes I just get this heaviness of sleep over me. And after work, I have to take at least an hour nap because I am that drained. Pray for me that I don't have any underlying issue going on. What else is happening? Today is Saturday. So a couple days past the appointment. Now I don't know if I slept wrong, but now I feel like some neck pain and some discomfort. I start to say, oh, okay, is that metastasis? I think you all get it. People who have had cancer, I think you understand how troubling it is to have a disease, and especially when it comes back. Now I'm on such high alert. When I had breast cancer the first time, I did not think about it coming back. But now that I was diagnosed with a recurrence and gone through treatment, everything that I feel, and I know I made a video about this before, everything that I feel makes me wonder, is that something to do with cancer? Is that a tumor growing somewhere else? Tell me, what do you do when your mind just starts racing? For me, I know to pray. I know to go to God. I know I trust him, and I always tell him that I trust him with my life. And I've been asking him lately, God, I know you are going to do whatever your will is for me, but I continuously ask him to heal my body because my family, specifically my sons, need me. I had the treatment 14 years ago, 15 years ago. Now I had treatment again. So again, I don't know what is happening in my body. I just pray that, again, nothing is growing. I'm on the potassium pills. I'll see if that will kind of bring it up. I've been trying to increase my vegetable intake, specifically the spinach, bananas, and anything with high potassium. So I'm doing that. See the primary doctor on Thursday just to check my levels again. But My honest thing today is to come on here to be transparent. So if you are struggling still with cancer stuff or just any type of illness, just know that we'll get through it. Just know that it is okay to have bad days, because I get on here and I'm so positive all the time, and I try to be. For the most part, I really am. But this past week, since I got the news about low potassium and low glucose, it just, for whatever reason, it just bothered me. It bothered me so much because I appear to look like this healthy person, which I think I am. I mean, I hope I am, even though, cancer makes it seem like I'm not. I get people, even when I go into the doctor's office, the nurses, they're like so glad to see me. Oh my God, you look so good. No one knows like what you're struggling with. They don't know that you can still struggle with not knowing if you are cancer free, not knowing if you are going to succumb from an illness that people don't see. They just see the outside of you. They see the outside of you and you appear healthy, you look good, you're positive, you're encouraging other people, you're motivating other people. But people like that, like myself, we have hard times too. We struggle too. So my bottom line is, with all my ramble, is that I will get through it. If you're struggling, you will get through it. Pray if that's what you do, and find your support system. You are not alone. If you feel alone, I am here, because you can talk to me, whether it be on here or on the side. I want you to have a great day, and I will talk to you soon when I am feeling a little better. Take care. Bye.